To do this is going to take a political answer. I do not believe that this system will in some way self-correct, that you will see Medicare change because costs have gotten too high, that you'll see commercial insurance change because premiums are too high. I don't think that'll happen. You'll see a growing number of people who don't have health insurance. You'll see them flood our emergency rooms. It will drive costs in state government to the point that we can't fund other needed programs such as education, public safety, and the judiciary. Uncontrolled healthcare costs are now driving most state budgets.
Our healthcare system is sick because it costs too much. We can save 25% by adopting a single-payer system. We can save with meaningful malpractice reform. We can save by adopting a national electronic medical record. We can save who knows how much by disallowing the mass marketing of prescription drugs and educating the public about end-of-life issues. Finally, we can find dramatic savings by paying our primary care providers adequately to do the preventive health care we really need. Our healthcare system is a bizarre blend of the worst of capitalism and the worst of socialism. It isn't a system at all. We need to get over our fear of the government and embrace the idea that in healthcare, somebody needs to be in charge so we can keep our eye on the prize, which is health, not profits.
In poll after poll, the majority of American physicians say the national health insurance system would provide the best care for the American population for a fixed amount of money. We need Congress to start listening to the American people who want and need national health insurance and to stop listening to the private health insurance industry and the drug industry who are saying, don't do it.
I don't think we need more money in the system. You know, if money was equated with health, we'd have the best health population statistics in the world, and we're down right around Cuba right now.
Look to the historical track record of healthcare systems that work. The European systems have worked. They've held down costs. They're popular with the citizens.
Access is necessary, is important, but it depends on controlling costs, and you're never going to control the costs until you have a good, workable, single-payer system.
Congress, right now, you think that you can serve the pharmaceutical industry and the private health insurance industry, and the voters won't notice. But the one thing you need more than the money that these industries pour into your political campaigns is votes. And God help you if you ever find that the votes are going in one direction and the money in another. I think then you'll have to go with the votes. So really, it's up to the public, and I do think the public is starting to understand what's going on.
If people understood what you just described in terms of the values inherent in our healthcare system, and we failed to do anything about it once those are clear, I think it's a very, very dark reflection on our society, and it would mean that we are willing to utterly sacrifice and mortgage our children and grandchildren's future to avoid having to make any difficult choices ourselves. In my heart, I don't believe that that's where the American people are, but I'm not sure that there's so far a lot of political leadership to pull them above that.